Liberia has an estimated population of 4.8 million people according to Liberia Institute for Geoinformation Statistics, LEGIS. According to last Liberia Demographic Health Survey, 49% of the people make up the rural population. Maternal mortality rate stands at 742 over 100,000 live births. Under 5 mortality rate is 93 over 1,000 live births, and infants mortality rate is 63 over 1,000 live births. Neonate mortality rate is 26 over 1,000 live births. The CFC initiative applies an integrated approach to address overlapping deprivation of children with routine evidence-based program monitoring based on key data from the community and health facilities.
CFC, or Child-Friendly Community Real-Time Monitoring, is a strategy that was introduced in Liberia by UNICEF since 2018 with the aim of reaching children of rural communities with basic services in terms of nutrition, immunization, and birth registration to ensure that we monitor every child from birth up to 5 years or so with the intention to track their nutrition status as well as their immunization status.
The CFC activities is premised on 5 components: local governance and accountability.
Part of what we did as the Health Facility Development Committee, we decided to fence the entire clinic, that cattle cannot run into or any other person cannot just pass in. The second one we did, we fenced the placenta pit. And also fence our hand pump.
We know that everything that we do at the community level, the local government or the local authority has to be informed. Besides being informed, they are responsible for the health of their community.
From the introduction of the child-friendly community and the real-time monitoring program, there have been great improvement. Great improvement in the sense that our community health volunteers and our community health assistants do a routine follow-up with those mothers who have children under 1 to go to the hospital or the health facilities for their routine vaccination, and those women who are pregnant to ensure that these women visit the health facilities for their routine and regular antenatal care visit, and those mothers who are pregnant in their 8 months to go to the facility for delivery.
As a community health assistant, my work have cut down the malaria cases in children in my community, and my work have cut down the home delivery because I encourage pregnant women to deliver at the clinic. So my work has also cut down the incompletion of vaccine because I also encourage children mothers for their children to take vaccine on time.
As part of my work, I talk to pregnant women to eat nourishing food and also encourage them to visit the health facility, and when they eat pee, they should go there to give birth.
The way they're going around is good for them to take the people, all the baby moms need to go to the hospital, because some people can play high, they can go to the hospital and say they can give birth in the hospital. It's not good for you to give birth in the hospital. I would like to say the work of the CAV people is good.
The CAV, you can go around, you can load in your baby book. The time is also go by. They will tell you, if you say your child sick, you can load in the book and tell you, get the baby to the hospital.
We have children at the community now, they don't have the birth certificate because mothers were not carrying their children to the health facility.
The level of our issuing the birth certificate, it helped a lot through the intervention of our UNICEF. It helped a lot where we are now seeing people, the parent, when they come into the office or offices to register their children.
The real-time monitoring was officially launched in 2019, aimed at transition from paper-based registry to digital application. 334 community health workers were trained on the Liberia CFC RTM monitoring app.
A child-friendly community real-time monitoring app that was introduced by UNICEF and partners was able to do a lot. For example, prior to the introduction of that app, we have been doing paper-based, basically collecting data, informing, mothers and what have you. The CHAs can now use their smartphone to be able to communicate information, timely information to the mothers. The CHSs as a supervisors can be able to follow up on the CHAs, on their performances.
When a CH is in a community, carry on his or her duty, that signal will also reflect on me and we know what is actually going on in our community to be ready for action taking.
So now the DCT comes about now, we are able to just go through the phone, put in our report and just send it and make our work very easier.
They're using those gadgets to get data, and then those data are then used by the community for decision making, which is then reported by their supervisor on a monthly basis.
The CHA provide a holistic service to the community. Besides that, at the national level, we also be able to coordinate the activity to make sure that the services is provided. So that integrated, making sure that everybody on board, so that everybody have a say into what we are providing at the community level. That is the approach.
The CFC program has not been void of challenges such as the end of the World Bank support for incentive payment for community health workers in the southeast of Liberia. The outbreak of COVID-19 greatly affected the overall program implementation. Thus, despite the immense progress in the overall program indicators, there is a greater need for financial support to the core CFC services: immunization, nutrition, WASH, and birth registration.
We want to use this medium to say thanks to UNICEF for their continuous support, but not to forget the Bill and Melinda Gates Foundation, who have, through UNICEF, supported the Liberia Community Health Program. We know that the child-friendly community real-time monitoring is a very good strategy to improve the lives of the children in Liberia. We have achieved a lot of success. This, in my mind, will be able to bring not only relief to the Liberian children, but also bring quality to the National Community Health Program. So we want to use this as a medium to say thanks, and we look forward to integrating this into the national platform.